Welcome everyone to this first UNDC event of the new year. I'm very excited to kick off a new series we're doing. We're calling it Digital Spotlights, and it's where we highlight the huge variety of program areas in which digital technologies and capacities can make an impact. And before I start my introduction, I'm gonna hand over to Alain, who is the director of the Department of Digital Health and Innovation at the World Health Organization, for a brief introduction before he has to leave to pick up the engagements at Davos. Alain, over to you.
Thank you so much, Julia, and thank you everyone for joining today. Such a privilege to be with you across the UN digital community. As you may imagine, this is a hot topic of all of our sectors and across all SDGs. And I'm actually serendipitously here at the Gold South of the World Economic Forum at Davos, where digital and AI are being discussed across every sector, across all SDGs, in how we responsibly leverage technology to accelerate the global goals, especially those for us in global health. Really a critical area of needs, as we've seen countries across our 194 member states asking us for guidance and direction in terms of how do we use these tools to accelerate progress in SDG2. So first of all, apologies for the loud noise. It's hard to find a quiet spot around here, but our department, if you can go to the next slide, our work in digital health and innovation falls within the science division of the World Health Organization headquarter offices. We support all 194 member states in leveraging digital health to achieve digital AI and other tools to achieve health goals. Our work is divided into two parts. One is really looking at strengthening the supply side of the equation, and how do we basically help governments and implementation agencies achieve their health program delivery goals in terms of making sure those programs are efficient, they are reaching the populations that need these services the most, and also ensuring that we're accountable for those outcomes that are most interesting. On the other side, we're also looking at strengthening demand. That really looks at individual agency, helping countries reach their citizens with effective, timely, and accurate information, but also making sure that people are going through their digital journeys, that we are there with them in their everyday lives, in the applications and tools that they are using, ensure that they have access to health information and are able to reach care in a timely way. And so today you'll be hearing from a number of members of our team, from Dr. Derek Monene to Dr. Garrett Mell, working respectively on areas of this supply side challenge. You'll be hearing from Andy Madison, who leads our digital channels work, looking at strengthening the demand side of the equation, and we'll be hearing from Samir Pujari, who leads our work on artificial intelligence, really on both sides of that equation, both supply and demand. So if we can go to the next slide, please. I believe we're going to run through a quick scene setting and then a poll. So just to say that as an agency, WHO has embraced digital now since at least the last 20 years. It's been part of many, many program areas. And more importantly, if you go to the first sector, digital is baked into the DNA of our general program of work, with 64 different mentions of the use of digital AI as ways of accelerating the mandate that we have to deliver care to deliver guidance to our member states. Now, there have been 3 member state resolutions culminating in what is known as the global strategy on digital health, and this is something that Derek will share a little more about. But we're really looking forward to working across UN agencies since the launch of the Global Digital Compact that challenges all of us to really think about not just digital verticals, but the cross-cutting need for foundation. Because the digital public infrastructure, the digital commons that are needed for systems to work across our various sectors, whether we're working in health, in financial inclusion, education, or agriculture, are commons that benefit all sectors of our UN system. And so as we look to these foundations, we really want to think about the elements of leadership, governance, policy, ensuring that there are clear directives around interoperability and standards, and making sure that all of these together create an environment where we as UN agencies aren't working in isolation, but working as part of a fabric of stakeholders that includes the public sector, the private sector, and other implementation partners who are working with us to make sure we can leverage these tools to optimize the work that we do. So without further ado, I am delighted to pass things over to my colleague, Derek Jimenez, who will walk you through the overarching architecture for which we work. And increasingly, I think my invitation to all of you on today's call is to explore ways in which your work and our work can be complementary, and that as we look at the same stakeholders that we have as the governments that make up our member states, that we are able to amplify the investments that we are making in time and effort and in dialogue with our counterparts in government to accelerate the digital goals that we have collectively across this ecosystem. So really thank you all. A robust audience of 140 of you who have joined today. Please do reach out if you hear things that resonate with you, and there is certainly a lot we can work on together. So with that, over to you, Derek, and thank you so much. Apologies again for the background noise.
Thank you very much. Thank you very much, Alain, for actually joining us despite the multiple events taking place on your site, and also more importantly, for really emphasizing the work of WHO in this particular space. Listeners, we're thankful for your participation, and so we will be getting into a series of what we've called rapid fire sessions to really unpackage the points that our director, Dr. Alain Labrique, has highlighted in broad strokes. I'll kick off with the first fire starter, and then there'll be 4 other speakers after me. We'd like to ensure that we have a good Q&A session at the end, so we have 15 minutes planned for Q&A. The first fire starter, which I'll be covering, is really focused on the role of the Global Strategy on Digital Health, the Global Initiative on Digital Health, and the interagency collaboration through the World Summit on the Information Society. As our director mentioned, the work that we're pursuing at WHO in terms of digital health is being executed side by side with other UN agencies who are part of the UN 2.0 mechanism and other global engagements such as the World Summit on the Information Society. So on the next slide, we will be introducing the global strategy on digital health that culminated in the 3 resolutions that our director just mentioned. The global strategy on digital health is all about fast-tracking universal health coverage as we pursue the 2030 agenda. And so digital has continued to be a major enabler of the UHC agenda. 70% of those actions in the SDG are informed and fast-tracked by digital. Our global strategy on digital health is 4 things. It's focused on knowledge transfer and capacity building in countries. It's focused on using national strategies as a vehicle to achieve the transformation in countries. It's a focus on governance, enabling countries to govern the national digital health ecosystem so as to ensure scalability, ownership, and also fast-tracking universal health coverage. And lastly, it's all about putting people at the center, ensuring that health systems are built with people in mind. Now, on the next slide, the screen you're looking at right now is a snapshot of the progress member states have been making over the past years of transformation of the health sector. As of last year, for which we're pleased to be announcing the progress member states have made, we have had 129 countries deploy a national digital strategy to inform the transformation in countries. And most countries globally are on maturity level 3 when it comes to the building blocks of leadership, but governance, strategy and investments, legislation, workforce, standards, infrastructure, services, and applications. And so the progress countries are making is quite tangible in terms of really using digital in informing the delivery of services in countries. Now, on the next slide, what you are looking at are the 3 principles that we are promoting to ensure sustainability of transformation. So at the heart of these three principles, it's really having one plan of the transformation on digital in countries that everybody feeds into. And in terms of making sure that this one plan is attained, collaboration in terms of everybody acknowledging the challenges that exist and how to address them, and making sure that there's an intersectoral coordination in countries that brings all stakeholders together to pursue that one plan, and ensuring that implementations are also based upon evidence. Now, on the next slide, what we're really dealing with here is how we actually achieve attainment of these 3 principles. WHO is pleased to be able to announce and continue to announce the Global Initiative on Digital Health, which is a vehicle that we're using to deliver on the global strategy on digital health, but also on those actions that we have agreed at the UN level through the World Summit on the Information Society. WHO and ITU have been working together on pursuing the e-health action line of the World Summit on the Information Society agenda, and the Global Initiative on Digital Health is a vehicle that we're using to achieve that. Now, on the next slide is a breakdown of the 4 pillars of the Global Initiative on Digital Health. First is really putting countries first and ensuring that we're listening to the needs of the countries and publishing these visibly so that all actors that are supporting countries can coordinate in this journey. Then second is the whole issue on resource alignment, making sure that resources going into the country needs are coordinated. Then thirdly is really addressing the issue of what's a bare minimum package that is needed to ensure that countries have the right tools to pursue the transformation agenda. And then fourthly is convening, such as this meeting, ensuring that all actors are being coordinated and are coordinating at the global, region, and also national level. Now, the next few slides simply give illustrations of some of these tools that exist. But we'd like to just emphasize that in order to fast track the 4 objectives, WHO has emphasized continuously the need to invest in foundations, the need to align with national health priorities, and the need to measure maturity status of countries and develop those actions that are needed to ensure that countries are able to progress on the transformation agenda. So the 7 building blocks right at the base of this diagram are really foundational for sustainability. And the entire workflow that you are seeing right now, that includes the development of a digital strategy, an investment roadmap, enterprise architecture that informs the kinds of applications that will be built remains critical. And so scalability and ensuring sustainability remains critical as we pursue this particular agenda. Next slide. At this particular point, it's my pleasure to introduce the next speaker who will be taking us through some specific examples of WHO's work in this area of work. And so I'm pleased to introduce Dr. Garrett Mayo, who is Unit Head of the Digital Health Systems Unit in the Department of Digital Health and Innovation. Thanks so much, Garrett, and over to you. Take it away.
Thanks a lot, Derek. I really appreciate it. And it's an honor to be on this call and within this community of other like-minded UN agencies. I'll talk a little bit about the Global Digital Health Strategy and its role in supporting a number of different efforts that are happening at country level. We know that countries are trying in the health sector to achieve digital transformation, and that really requires a number of different actors, not just us in WHO, but other actors across the ecosystem to help countries achieve, for example, these 7 different goals that we've heard many countries try to achieve. Achieving quality and continuity of care, optimizing supply chain management, getting everyone a trusted personal health record, ensuring financing and payments across the healthcare sector, building a capable workforce, ensuring that disease systems and climate resilient systems are incorporate AI, and then ensuring that telehealth and other systems work together to deliver upon the kinds of goals that we know health providers and their patients see. We see digital providing that support to enable and unlock the entire health system. We, as many of the UN agencies across the House and in collaboration with many of you, have really adopted an approach that we see countries rapidly moving towards, which is utilizing foundational digital public infrastructure combined with health sector specific digital public infrastructure, and then combined with functional applications and standards in the health sector in order to achieve multiple end goals, those 7 goals that I mentioned before, incorporating as well the needs of the patient, the provider, and the diversity of actors in the ecosystem. I'll give an example of this work, and this has involved a number of UN agencies, including WHO, ICAO, IOM, and others, collectively working towards the achievement of a mechanism of a trust anchor that enables and facilitates the ability to issue and verify health records and health certificates. I'll just note that this work came out of the COVID pandemic, but has emerged as an infrastructure core DPI for the health sector to unlock the potential of health records to be used and verified within domestic settings as well as across country borders. The example that I'll raise and share with you today is the work that multiple countries, including the Kingdom of Saudi Arabia, Indonesia, Oman, Malaysia, and work together to utilize this DPI to issue and deliver certificates for those pilgrims who were going to Hajj and needed to carry their health records with them. So roughly 250,000 pilgrims were able to carry their health records with them. And in the events of emergencies, over 80% of those who had an emergency were able to share with those in Saudi Arabia their health record. We utilize open standards for this work, including HL7 FHIR, International Patient Summary, and of course a public key infrastructure and the use of digital wallets at national scale. This kind of infrastructure unlocks not only the Hajj health card, but also the digital yellow card, as well as domestic uses like maternal and immunization card records. We work to ensure that, and have worked with many agencies, including UNICEF and UNFPA, around developing content packages we call smart guidelines that are validated content that can be then delivered across digital public infrastructure components across multiple countries, ensuring that the delivery of health care is consistent and aligned with evidence-based recommendations. We have also worked with UNFPA and UNICEF and others to deliver and develop guidance documents around helping countries then not only utilize this content, but then begin to bring this to life in their own health program areas with the digital ecosystems and policies that they have in place in order to ensure the data is collected once and benefits the entire ecosystem. Lastly, I'll just note with about 5 other UN agencies, including HELENA, which is the Global Regional Informatics Association in Africa, we worked to deliver a training curriculum for roughly 300 participants across 50 countries at a global level. There were 2 tracks, the architecture track as well as the developer track, in order to help facilitate digital transformation of the health sector. And we look forward to, in the next coming year, shifting this Open Digital Health Summit approach to a cohort of countries working around at a regional level around specific goals. And we would very much welcome multiple agencies, those on the call, to join us and many other UN agencies to help deliver capacity and strength for digital transformation. And I'll pass over to Samir Pujari, who's the team lead on artificial intelligence for health. Samir, over to you.
Thanks a lot, Garrett. And thanks everyone again for adding this discussion. Very interesting. to have a UN-wide committee discuss. What I'll talk to you in the next 5 minutes is on the AI work that WHO is doing jointly with 2 UN agencies, ITU and WIPO. And we are setting, but just to set the stage here, we all have seen that this year has marked that AI is taking over a new realm of successes, and we've seen that from the Nobel Prizes, both in physics and chemistry, which are tied to the AI world. So I think there's a lot of potential that we're seeing going forward. WHO has, in the next slide, please. WHO has been working since 2018 to start looking at science around AI and how it can benefit health services in general, and building on the work that we have done with ITU from 2018 in 2023, 2 years ago, 3 UN agencies jointly launched a global initiative on AI for health. WHO, ITU, and WIPO, and you see the leadership of these 3 agencies launching this event at the AI for Good Summit. There are 3 main pillars in this global initiative. The first one is normative guidance enabling pillar, which is around building science, normative guidance, standards, principles, and I'll talk to you and give some examples about it. The second one is bringing together the community working on AI for health so that we can replicate the investments, we can replicate the knowledge at a faster pace. And the third one is around implementation, helping actually take the guidance, the policies, using the networks and implementing and making sure that AI is delivered rightfully at the ground level in healthcare spaces. Next slide, please. Just to build on the enabling track, these are some of the examples that WHO has been working on, delivering guidance, normative standards. One of our guidance on ethics and governance of AI for health, a specific guidance on language models, using ethics and governance of AI for health. We have guidance on regulations, working with the regulators. And then topic-specific area guidance also is something that we have been releasing. An example is the sexual reproductive health. The example is AI in traditional and complementary medicine. So there's a lot of work going on. We also have a few courses that have been released, which have been used by over 25,000 users now globally. One is specifically for policymakers, and the other one is very specific for developers and designers. These are all available through WHO websites, and all the links are over. Next slide, please. So in terms of the key action that WHO is prioritizing going forward, what we're doing is trying to make sure that the countries are ready for the AI onset by building the governance structures and enabling guidance so that they can be used by countries. Second is to help benchmark products specifically so that these products are available for countries, whether it's for the screening of cancers, radiology, or whether it's prediction models in different cases. And then third is actually helping localization, working with partners and stakeholders. These are 3 key priorities. And working with partners, our intent is so that we can make sure that while we see the science growing, we see AI picking up, we are building the commitment, the collaborations at the ground level, and most importantly, sustainable investments that we've seen have been a problem in the past in the different domains of healthcare space. So this is what the global initiative is focused on doing. Next slide, please. Just an example, a practical one is by benchmarking specific solutions. As you may be aware, screening of cervical cancer and treating processes in rural Africa costs several $100s per patient. We're trying to use AI to bring the service to the patient, to the provider, taking the healthcare provider to bring it to the household, so that instead of clinical care having to do at the hospitals, we can now reverse the mechanism of healthcare provision to point of care, reducing the cost several hundred times. And also the accuracy of these products are comparable to what we're seeing in the field in the actual spaces. So obviously giving a different dimension to the pain points in the health systems. Just an example I want to put out practically, that we're not just around policies and guidance, but more practical on how it can be delivered. And this is happening across the domains. If you go to next slide, in several areas of AI maximum, that AI is, the science is growing, whether it's tuberculosis, cat-based tobacco, cat-based diagnostics, to sexual reproductive health, to breast cancer, to diabetic retinopathy. We have seen a lot of areas that AI, the science is growing, and we're working on these areas. And I wanted to put this slide out there so that if you in the UN system are engaged, whether it's health securities, whether it's drug discovery, whether it's cancers, we'd love to partner with you. We already have a massive engagement. If we go to the next slide, of over 500 partners, some major agencies in AI involved. And so my only call here is, if you're working, let's not do vertical things, join hands. We already have 2 UN agencies. We're happy to have more. So back to you. And I think I'm handing over to Andy from here. So Andy, over to you.
Good morning, good afternoon, good evening, everyone. Pleasure to be here. My name's Andy Pallison. I'm team lead of digital channels, and I'm going to tell you a little bit about some of the work that we do in my team. Next slide, please. Basically, the job of my team is to get more health messages, more guidance, and more recommendations into people's digital journeys so that they can live happier and healthier lives. Next slide, please. I want you to consider what you've all got in your hand, and probably many of you are on while you're listening to us talk today. Your mobile phone, we have over 80 apps on your mobile phone. The industry standard is that you use about 9 a day, maybe 30 a month. And whatever those 9 are on your phone, that's the ones that we want to be on so that we can reach you with this guidance and messaging. The idea is not to pull you into our social media channels or onto our website. The idea is to get our content into people's digital journeys and on apps that they use every day and that millions and billions of people use every day. Next slide. We will have 3 pillars of our work. The first is that we raise good content, whether it's our own or Ministries of Health or selected trusted partners in the ecosystem. The second pillar is that we fight misinformation. And those two, of course, go hand in hand because misinformation thrives in a vacuum. So it's very important that we work together on those. The third pillar of our work is to gain user insights and gain science to find out what works and what doesn't. And where there are gaps in science, there are also, the job of our team is to find those gaps and to do call for papers to make sure that the community at large is actually creating the evidence and the science to show which digital products work. Next slide, please. I'm going to tell you about just 2 of the projects in my team, chatbots and channels, which we've lumped together. And the other one is FIDES, which is a network of healthcare influencers, which I hope will be interesting to you. We have other ones, but these are the 2 I'm going to focus on today. So when it comes to chatbots and channels, next slide. We've got chatbots and channels on multiple different platforms, whether it's Viber, WhatsApp obviously is the main one. We've had them online on websites and things like this as well. It's an excellent way of reaching people where they are. As I was saying before, reaching their digital journeys. They're on WhatsApp. If anybody's like me, I'm completely addicted to WhatsApp. I'm on WhatsApp all the time. This is a great way to get content into people's lives. A chatbot allows people to ask questions and gets replies from an authoritative source of health information, which we are. It's really good for communities which have low bandwidth. A lot of the work that my team do focuses on vulnerable populations, people with either low bandwidth or data charges or connectivity issues, people who will be who are connected to the internet in some shape or form, but don't necessarily have the privilege that we have of unlimited data, connecting on multiple devices, and easy to stream content around the world. So a lot of our products focus on small data packages for these vulnerable populations. Next slide, please. The impact of our work on chatbots, I think, according to WhatsApp, we have the largest chatbot during COVID that's ever existed. 23 million users just on WhatsApp. We have several other million on some of our other chatbots, but basically we're reaching global audiences. During COVID, of course, we had our content translated in 25, 35 languages, depending on how the disease was spreading. And of course, because of resources, unfortunately, we've scaled that right back down to just English at the moment. But the technical infrastructure is there and the experience in the team is there to allow chatbots to be big and impactful. Next slide, please. Next slide. We've just covered that. And you'll ask me, I hear you all asking in the comments, does it work? Do chatbots actually work? Well, I'm going to use an example from Recife in Brazil. It's a municipality, it's a city in the northeast of Brazil, where they've launched the Post-Life Journey app. And you can see there the highlighted areas that vaccine applications for vaccines and people taking vaccines increased significantly after this chatbot that was launched on WhatsApp was launched to all users within Recife. So they were sent push notifications about the various different vaccines that were available, and links to real-life services to allow them to go and book appointments and actually take the vaccine. You can see quite a significant increase in vaccine uptake thanks to this tool. Next slide, please. I've asked them, by the way, to actually do a peer-reviewed document on that because I think it's really impactful. For those on WhatsApp, you'll have seen that they have launched channels. Of course, channels have been available on products like Telegram and Viber for many years. But WhatsApp, being the largest chat app in the world, has launched about 18 months ago. And we were one of the first people to launch with Meta. We got heads up about this, and we got online, and we've got more than 10 million followers already. We've not done anything. There's no rocket science behind what we're doing. It's just consistency and good messaging going out. Easy, zero technology, and very much a very light communication lift. Next slide, please. FIDES, I'll tell you a little bit about FIDES. FIDES is a network of healthcare influencers that we activate to help spread messages across social media. It's not your usual influencers program. Everybody here is a healthcare professional or working in public health. Next slide, please. The reach, we have 800 members. We have 200 more sitting in the wings, and we have a reach of over 150 million across all social media channels. What we care about is not so much the reach, but the behavior change. So we're working with universities across the world to see how we can measure that actual behavior change so that people can have healthier lives. Next slide, please. Here's some posts while I tell you a little bit about some of the things to show you the difference of types of posts that we have. These are examples of some of our creators across TikTok. There's no sound to this, but you can also see with regards to online the diversity of them. The great thing about the benefit of these people is that they have all the traits that WHO doesn't have. For example, the humanity, the human instincts that allow people to understand messaging better and for our messaging to be more impactful. Next slide, please. They can use humor, wit, anger, frustration to get their message across. And it's proven that if people look like you, or if the same ethnicity, same sexuality, same sex, you're more likely to understand and absorb the content that they're providing. Next slide, please. Next. Does it work? Well, just looking at, again, as I said, we're doing working with universities to find out if it works. But here's some of the comments that we've had. I'll let you read those in your own time. And these slides will be shared afterwards. But we are making an impact, and we are helping to save lives one post at a time. Next slide. And I think we're heading back to you. Derek, back to you. Thanks very much.
Thank you so much for that highlight presentation, Andy. Very clear and crisp. I will now hand over to the last speaker in this rapid fire session, Dr. Stephen Wanye, who is president of HELINA. Stephen, over to you.
Thank you very much, Derek. And hello, everyone. My name is Stephen Wanye, as introduced by Derek. I'm currently the president of HELINA. HELINA stands for Health Informatics in Africa, and is a Pan-African health informatics network organization that has existed for the last 30 years to promote the practice and also development of health informatics and digital health across the African continent. We are a member to the International Medical Informatics Association, and I'll speak a little bit more about some of the work we're doing. So first of all, thank you very much for inviting us to this inaugural UNDC Digital Spotlight Series focusing on digital health. Really proud to be here and engaging with you all. So the first thing I wanted to mention is that HELINA works through what you look at it as a network effect. Basically, like I mentioned, HELINA comprises of professional societies that are domiciled in the countries across Africa. Right now, we've got about 17 who are fully registered with us. They're members, and we've got a partnership deal with them. And we're working with 3+ more to help them register with their governments and get set up and start working. So for that reason, one of our primary interests is to professionalize digital health and informatics in Africa, which means that we really focus on professionals or anybody who wants to get into informatics and digital health and meaningfully and productively contribute towards developing the health sector in their country to achieve the health sector goals as set up by the Ministry of Health. So for that reason, we work very, very closely with institutions that partners, so with the academic institutions like universities contributing towards their curriculum, and also a lot with the in-service as well, where I think, as most of you know, informatics and digital health is a very nascent profession in many countries in LMICs. And so it's not even recognized by most governments as a formal cadre of staff. So working with governments to get it recognized. And so as I speak about the enabling environment, the component around legislation and policy is one that is of importance to us, because we know if that doesn't change, then governments cannot recognize professionals, who call themselves digital health experts and health informaticians. So that's how we are working very closely with WHO and other partners globally to work very closely with not just the Ministry of Health, but also other arms of government to ensure that you get this recognition, and therefore we're able to build a very clear journey for those interested to get trained, formally trained and practice in digital health and informatics. And then within the industry itself, we know there's a need to continue sharpening your competencies and staying current and practicing the right things, as has been explained and described by my previous speakers. So for that, we are partnered to Africa CDC, which is a technical organization under the Africa Union, and we've been working with them to develop the Public Health Informatics Fellowship. It's based on a lot of work contributed by many of us who are here, including WHO, and it's based on a very robust competency framework, with the idea being that we want to build the right competencies for these practitioners once they get into industry, that they're able to contribute towards the achievement of the health goals across the whole region. So Africa CDC primary mandate is cross-border health, or across country healthcare. And so working closely with them to ensure that you've got the right professionals from different backgrounds, whether you're from the health sciences or from technology, but you've got the right digital health and informatics competencies to utilize digital health interventions meaningfully, responsibly, and ethically to help your government to achieve its health goals. So those of you who've been working a lot in building workforce, you're probably familiar with the need to target audiences. So we also subscribe to the same approach where a lot of our interventions are targeting the strategic leaders, tactical leaders, operational leaders, and the general population who also comprise of the consumers of healthcare. One thing I want to mention here before we go to the next slide is that we're very keen also to ensure that we engage effectively with the political leadership. Over time, it's become very clear to us that if there isn't a very clear demonstration, articulation of what is the value of digital health to political leadership, then there are some challenges. And so that's an aspect that we're working on. And we've started to see a couple of successes in a few countries that we want to promote as hopefully influencers to other countries across the continent, where once you have that political class fully behind digital health as an investment, and they see political value in putting their weight behind it, we're seeing a lot of success. The second thing that we do a lot as Helena is make our contributions to the enabling environment. Derek spoke about this earlier. There's a very clear framework for what is the enabling environment for digital health. And we prioritize a couple of areas, because there are like 8 of them. So we're, as I mentioned earlier, one of the areas that we're contributing to significantly is workforce capacity development, because that's one of the primary mandates of Helena and our culture over the 30 years we've been in existence. But beyond that, we're also very keen to contribute towards the digital public infrastructure for health. And I know that's a fairly new discussion, particularly in the health sector, but not so much in other sectors. And so for that, we're working beyond the health sector, bringing in other sectors. So, taking a multi-sectoral approach, working with the Ministry of ICT, Ministry of Justice, and all that, because you need all of government approach to make the infrastructure fully functional for the health sector as a component of the society at large. So that's one piece of the enabling environment that we are contributing to significantly. And the other one that we're also working significantly in is standards and interoperability. And so again, we know, with innovation and with the technology evolving really rapidly, there'll always be a multiplicity of tools and solutions. But we need to all agree how to, what defines the quality of those tools and how those tools coexist with each other. So we've invested heavily working with WHO, working with standards development organizations like HL7, to promote standards that are respectful of the various contexts and that are lawful based on the jurisdictions you're working within. So as Gareth mentioned, that was one of the hallmarks of the Open Digital Health Summit, which is emerging as a very strong platform to promote these two sort of complementary two sides of the same coin. For that reason, Open Digital Health Summit last year, 2024, was a culmination of two previous fora that we had, starting in 2022, I believe, where we met in Kigali. And we had a really successful hackathon. We built a lot of things, but using this approach, and also met again in Cape Town at a Helena conference that we held in Cape Town. Continued working on the successes of the Kigali workshop. And then last year we met in Nairobi at the Open Digital Health Summit. And as Gareth mentioned, with everything we've learned, the capacity we've built and the momentum we've also developed, we're looking forward to this cohort-based driven learning and experiential learning process. And this year, one of the opportunities we have is hopefully to do this again at the Helena conference. It's going to be held in Botswana at the last week of August, and all of you are welcome. So as a wrap up, I just also wanted to mention that a lot of this work builds on top of what WHO has laid out through the Global Digital Health Strategy and all the initiatives like GUIDE, as Derek has mentioned, and Alain. And one of the things that we've also joined forces to work on is how do we accelerate adoption and utilization of all these really, really important evidence-based interventions. And one of that is through, some of you may are probably familiar with the full stack approach, where 4 main components have been identified as really key drivers and levers. And those are, the notion around open standards, as I mentioned earlier, FI is an example. Open technologies, there's initiatives like the Global Goods and the Digital Public initiatives, goods initiatives, to provide open source, well thought out technologies. And then there's open architecture, like OpenHIE and others. And lastly, there's open content, for example, smart guidelines that, again, we are working very closely with WHO to move those forward. Derek, I think I'll take a pause there. Thank you.
Thank you very much. Thank you very much. Thank you so much. Thank you so much, dear speakers, for really keeping to time. We have now the 15 minutes that promised at the beginning. We've heard from 5 speakers, including our director, who gave us a framing on WHO's work vis-a-vis country support and coordination with our ecosystem. And he spoke a lot about WHO's approach towards the transformation of countries and described the 20 years that member states have provided WHO to support the ingestion of technologies in health. Then 5 speakers gave illustrations of specific areas of work. I spoke about the global strategy on digital health, which is expiring this year and is up for a proposed renewal, which is a vehicle that we are using to transform the health sector and to coordinate with UN agencies and other partners. Dr. Gareth Mell spoke about our approach towards digital public infrastructure and gave specific use cases, and the Digital Public Certification Network's link is in the chat. And then thereafter, the use of AI in health. So Samir Pujari has really illustrated how we're leveraging emerging technologies. And then thereafter, the whole issue around connecting with people. So Andy Pattison gave practical examples on how WHO is really connecting with people by being in the ecosystem in which they exist. And then last, we had one example of a regional network through Stephen Wanye functioning in Helena, how Helena is supporting the whole agenda of digital public infrastructure, but also really working with informatics professionals. And the specific use case that he highlighted was the issue of enabling local producers of digital solutions to really be able to produce quality informed digital solutions. The floor is now opened. There are some questions that have been already responded to in the chat. Take advantage of those items that have been responded to, such as a question on country support through the strategy, we've responded to that particular question. WHO and regions have been working with country offices to support member states, and the Global Initiative on Digital Health is that particular vehicle. There's a question on the monitor. We're very excited on the contributions on the monitor. There will be a second version of the Global Digital Health Monitor, which is the means by which we measure maturity of countries' digital transformation, that will be released shortly. It provides visibility at the macro level. Then there were several questions on artificial intelligence that I would ask my colleagues to speak to as needed. So why don't I then pause to check if any of the panelists have a need to speak to some of the questions that were in the chat that have been responded to. Any questions that you like to emphasize, for example, Samia on AI, and Garrett, Andy on the question on chatbots, and do feel free to pick any question, Garrett, that you might want to take, and then we'll continue the QA. Let's start with you, Samia.
Thanks, Derek. Now, I think the questions were very generic, of course, and more intent to join and partner with the global initiative. So I have put in the link, the chat, as well as the email address, which is available. So if you reach out to us, we'll be happy to connect back and see how we can partner and meet the needs of the different areas of work that you're working on. So I'll stop there. Maybe get over to you.
Thanks so much. Andy, there's a question on chatbots, and you responded to the effectiveness of chatbots. Do you want to just re-emphasize on that as well?
Yeah, sure. I haven't seen that question on chatbots yet. Let me see.
Oh, no worries, no worries. We can get to that as you...
The effectiveness of chatbots depends. One of the disadvantages of chatbots, I mean, the advantages are many. One of the disadvantages is that WhatsApp chats work because you have real life triggers. I see something on the internet I want to share with somebody, it's a trigger, and I share it with them. Somebody pings me and asks me about, what am I doing this weekend, XYZ. Real life is impacting my chat. With chatbots, there's no such thing unless we can send push notifications. So what generally happens with chatbots is people will engage with them very actively, get their information, and then disappear and never come back. So the retention of chatbots is quite challenging. I'm not great at multitasking, I'm afraid, Derek. So I'm now looking for this question on chatbots to see if I've actually answered the question.
No, it's well articulated, actually. Well articulated. So thanks so much, Andy.
Can I just say, just to add on the positive side, it's a fire and forget mechanism. There is huge gaps in the healthcare workforce in the world. If you can use chatbots to relieve pressure on real life situations and real life doctors and nurses, this would be really good. There's an excellent tool out that the South African government does use called Mums Connect. Every mother, expectant mother, as soon as they're pregnant, gets enrolled in this chatbot, which gives them advice, and it's proven that it reduces the cost and impact on public health, especially in poor communities where nurses and doctors are really limited. So instead of having people coming in to real life services and asking doctors and nurses, is what they're feeling correct or normal as an expectant mother, they're actually getting that advice from a trusted source, which is the Ministry of Health of South Africa. I understand it's also being launched in other countries around Africa. I know that there are tools also in Brazil. With South Africa being the chair of the G20, I think there's a lot of opportunities here to roll out such digital tools that really work and that are financially very easy and cheap to set up comparably, and save infrastructure money and save actual money, because it's cheaper to be dealt with by a computer than an actual nurse. Thanks, Derek.
Thanks so much, Andy. Thanks so much, Andy. I'm going to turn to Garrett now around the complexity of integration of systems. There's been a question around how do we actually ensure that the different actors that are pursuing the transformation in countries are coordinated in the implementation of systems? Is there a common standard, for example, that they should be moving towards? How do we avoid, different actors going, apart than getting together? Thoughts on that approach, Garrett?
Thank you. And that question was great. The point around there's already organizational chaos. If we're just digitizing that, does that just then reinforce the nature of the system? We see digital as very much an opportunity to optimize and reflect on existing constraints and challenges by being able to look at and ensure that there are requirements documented that make up and really reflect on a common set of requirements that for a program area. So that point to within an immunization system or within a digital system that's meant to support non-communicable diseases or HIV or TB, those systems need to be documented in a way that we're able to then bring to life in information systems the benefits of optimization. And so task shifting, the ability to ensure that there's a common data model that is apparent across all systems begins to, I would say, ensure that those who are involved in the programs are able to look at that complexity to determine how to rationalize that and then be able to bring it to life in those digital systems. We do an area of requirements documentation, which is intended to be as a generic starting point for countries. We call SMART guidelines, and we are working with the ITU and a few other agencies around bringing to life national reference architectural plans or blueprints that give them a starting point to look at the health sector transformation alongside other sector transformation. But the core components of digitization in a health area needs to follow from the minimum set of data, the minimum set of capabilities that need to be delivered in that system. So we have really pursued a documentation strategy for that. The other question that I saw in the set of questions was really around procurement. There has been, I would say, a tendency, not only within the UN agencies, but across multiple agencies around really, I'd say, going with particular software solutions rather than defining the minimum set of requirements that then different software systems can be compared to. We really advocate for standards. We really advocate for minimum specifications to be defined, which then help in the procurement and really lessen that. Someone mentioned transparency or lack thereof. There's really a benefit of those specifications and documentation being used as something that a country or those who are doing procurement can really look to and compare products against and really have a much more transparent approach to making sure that those systems are going to adhere to standards, interoperability standards, but also the content that is aligned with really where many countries are going so that those products can be sustained and maintained by the countries themselves. Thanks. Back to you,
Thank you so much. Thank you so much. We'll address a few more quick questions. I'll take two as I give Andy to actually come back. I'll read the question on chatbots now, Andy, and then I'll give it on to you. I'll take two questions, but I'll bring, to your attention one repeating question on chatbot, which is really how, the potential of chatbots to improve healthcare and other services in underdeveloped countries. How can we leverage that? As we prepare, Andy, I'll just take two quick questions that are here. One is on digital literacy. Fully on board in terms of the value of digital literacy. There's an entire agenda at WHO that is aimed at ensuring that digital literacy and digital health capacity building is underway. We are building a competency framework that focuses on policymakers, planners, practitioners, and the population that really articulates the kinds of knowledge, skills, and attitudes expected of the beneficiaries. And so that's underway. Around NCDs, there's a question on NCDs, which are really spreading like wildfire. So WHO has an SMS-based intervention called Be Healthy, Be Mobile that is really intended to raise awareness, as the question is stressing, on the NCD situation and then empowers individuals to really take charge of their health. So great questions on digital literacy and also the issue of use of digital in NCDs. Andy, I'll give it out to you. How can low and middle income countries really leverage, digital channels to improve processes? Over to you.
Thanks. I think when it comes to chatbots, the implication is actually could be quite technically complicated and expensive to put in place to implement these chatbots. So what I would like to see is, and what we're working towards is guidelines and recommendations on how to create chatbots, including code, including content, which will help people roll it out. So we're creating these playbooks, which will allow ministries of health, trusted partners, to build their systems. Now, it's not going to be perfect because, of course, we're building on a global level, but hopefully by building a community of practice, if a municipality or a country or a region or a state creates a chatbot in a language on a certain topic, if they put that back into the community, then we can actually, everyone benefits. So we're hoping to launch those. We've actually launched them already, but they're not publicly available because they're going through some checks and balances on our side internally. But from our point of view, chatbots playbooks would be a really good way to allow people to get that out there. When it comes to channels, zero technology. WHO channel was set up by myself and a colleague. We are literally running it from this phone in our spare time with copy paste and reaching 10.5 million people without any kind of advertising. So definitely, if you have, if you're in the comms teams or risk comms teams and need to reach populations, check out channels. When it comes to chatbots, you do need infrastructure, you do need servers, you do need numbers, and you need technicians. And we're hoping that this community of practice, as I said, will make things easier for everybody. Hope that helps.
Thank you so much. Thank you so much. This is really an applied UN 2.0 approach. And as we have 2 minutes to go before I hand it back to Julia, I'll give our panelists 10 to 15 seconds for key things that you like to have participants take away from, starting with Stephen, then Andy, then Samir, and then Garrett. Stephen, 15 seconds, take home message.
I think from the take-home message is that we need to invest in professionalizing digital health and informatics. At the end of the day, it comes down to people. They need capacity, and only people can trigger the change we need around ourselves. Thank you.
Thank you so much. Andy?
For me, it's all about collaboration and sharing and science. I think if we collaborate more, let's stop reinventing the wheel. Let's find processors, standards that we can use, interoperability standards like the work that Garrett's doing, to make sure that we're all working in a common direction with common systems which can all talk to each other. Don't reinvent the wheel, share what you've done, and do science, proper science, to see if it works. Growth is not a metric that we should be doing. It's about behavior change.
Thank you so much. Samir?
Thanks. Andy, you used my words as well. So what my key word is collaboration. Let's not make the mistakes we have done in the past. And that's why I think this is a great forum to say that, is let's work together. We have seen some great successes when we collaborate in-house, across, and we all have strengths. So let's build on that.
Thanks so much. Garrett?
Yeah, just to say, I think in order to achieve health, digital transformation, it really requires all of us collectively, and WHO alone can't do it. So to help countries, collaboration is at the heart of this. So really looking forward to further those and strengthen those collaborations. Thanks.
Thank you so much. Thanks so much, viewers, wherever you are, for a rapid hour that we spent together. The Q&A were robust enough, and the speakers have spoken very articulately to the subjects. Thank you so much. Julia, over to you. It's all from WHO, and thanks so much for giving us this space. Over to you, Julia.
Thank you so much, Derek, and the entire team, digital team at WHO. Also, thank you, Dr. Stephen Rainey, for sharing your work and your insights today. Especially thank you for this, perfect wrap-up, closing thoughts. Very grateful for your participation. There's kudos in the chat for this being a very super creative event. This all goes back to your team. Thank you so much for this. Before we're closing the session, I just want to quickly draw your attention to the Digital Spotlight Series. We always have one component that is an overview, like the one you saw today, an introduction to the topic. And then next week, we'll use a format that you may know already from previous sessions, the Digital Transformation Expo. But this time, all the showcases of initiatives and projects from the UN system will be dedicated to digital health. It's exclusive to colleagues from the UN, and you will find the event invite in your inbox right after this call. But we're at time. I'm going to close the session here. Thank you again to our fantastic speakers. And thank you everyone for engaging and participating with your brilliant questions. Hope to see you at the Expo on Health, and have a great rest of the day.
Thank you so much. Thank you so much, everybody. Thanks. Bye-bye.
Thanks so much.